As Chung said, my name is Lily Wagner. I am a licensed clinical psychologist and a board certified behavior analyst and a mom of a child with autism. And I am the director of the Autism and Developmental Disabilities Clinic here at Waysman. And today I'm going to be talking to you a little bit about something that's really important to me and is a core mission of mine here, which is really demystifying the process of the autism diagnostic process. It should not be a mystery. It should be really transparent and open because we really rely on our community, on the people who work with children, on caregivers who take care of children to work with us and partner with us and help us in the diagnostic evaluation process. So thank you for being here today. Just a quick note about language. We'll be using specific language to reinforce the neurodiverse perspective of autism. So we're going to be using identity-first language. I'm not sure if you all are familiar, but that is saying things like autistic individual instead of person with autism. And we do that to just really reinforce the idea that autism is a core personal identifier for a lot of autistic people. And as I said, the words we use matter. And sometimes as diagnosing professionals or school professionals, we have to use specific language to be consistent with the diagnostic criteria set out for us. However, in our communication with autistic people, it is very important that we are neurodiversity affirming and we're using the language that they want to be called, right? So I'm going to get into autism assessment first. I'm going to describe the process of autism assessment, which many of you may be familiar with, but I'm going to try to bring in some of the recent research in the area and talk about autism assessment from both the clinician perspective as well as hit on some themes that have recently come up in some work understanding caregiver perceptions of the diagnostic process and some of the work that we're doing here in the ANDD clinic to try to address some barriers that families are experiencing and some of their perceptions. So autism assessment is based on diagnostic criteria that's defined in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. Autism is classified in this manual as a neurodevelopmental disorder that is marked by persistent difficulties or delays in social communication and social interaction across contexts, combined with the presence of restricted and repetitive interests, activities, and behaviors. As it is classified as a neurodevelopmental condition, these traits must be present from the early developmental period. See the cute baby? I can't even tell you guys how much time I spent looking up pictures of cute babies online to find, but and also, these traits must cause significant impairment in functioning in one or more areas, be that social functioning, occupational functioning, educational, et cetera. So that's the criteria as it's defined in the DSM. A comprehensive assessment, of course, is going to consider primarily those core features of autism as outlined in the DSM. But it is so much more than that. And I'm sure some of you may have had different experiences with comprehensive assessment, but I'll talk a little bit about, and I do want to say today that the diagnosis of autism can occur at any point across the lifespan, right? As young as 18 months up into adulthood. Today, I'm going to be focusing primarily, in my talk, I'm going to be focusing primarily on the diagnosis of autism in childhood because I'm a pediatric psychologist and that's what I know best. But it's just important to realize that this can occur at different points across the lifespan, and the collection of and what the assessment actually looks like will vary greatly depending on the age of the person being evaluated. But so a comprehensive assessment of autism is going to involve, along with looking at those core features, looking at different things like their cognitive functioning, adaptive functioning, their verbal ability, the presence, getting a full developmental history, looking at behavioral difficulties or differences, and then looking at potential co-occurring conditions or differential diagnoses. This is really important, not just because of treatment implications, but it's really important because it can really influence the degree to which these core features of autism present, right? Or impact functioning. A diagnosing professional is going to uncover or assess for all of these different things through a combination of methods that are going to range from interviews with key informants, review of records, unstructured observations, and standardized assessment using validated tools, right? Which can now be administered in person traditionally, but increasingly over telehealth, which is really exciting. And then I think I would point to the one point I wanted to hit on was with children, when I said that assessment can look different, if I am diagnosing a 2-year-old, I'm not going to be as focused perhaps on assessing for some of these co-occurring conditions like anxiety or depression, hopefully. However, that's going to come a lot more into play when evaluating a teenager who presents for an evaluation. So just one example of how these comprehensive assessments may vary by age. Okay, great. So let's talk a little bit more about the actual process of coming to a diagnosis. And I'm going to talk about this now from research we've gotten on the clinician perspective. So making a diagnosis is described in the literature as creating a narrative, right? And I love that description because it really is. We're collecting information from a lot of different sources, and we're trying to piece it together to formulate this story. And I think sometimes maybe, probably the fault of the professionals, we give the illusion that this is a really straightforward linear process, when in fact it is completely not. There is no blood test or brain scan for autism. And I was reading through some of the recent literature, and it was described as by Hayes et al. As a socially situated activity, which is really exactly right. So when I say that, we are gathering information on all of these different things, using these measures and listening to interviews and reviewing these medical records and educational records. And that is one piece of it, right? But we don't just take all of that information that's collected from this one point in time and throw it into a machine and spit out a diagnosis, right? There are other factors that are coming into play that have to be considered. A lot of the information that we get, we rely heavily on information gathered from the people who know the child, in this case, best, right? Their caregivers, their parents. A lot of times when parents come into the clinic, they're going to have different motivation for being there, right? Sometimes parents come in and they desperately are seeking a diagnosis of autism for whatever reason. Sometimes it's completely the opposite. They are coming in and they say as soon as they sit down in the chair that they do not want their child to have a diagnosis of autism. Again, for whatever reason, it always varies. And then also on the other end of it, we have to be aware of the potential consequences of receiving a diagnosis. Unfortunately, in this country, sometimes a diagnosis of autism is necessary to access specific services that may be really needed for a child. Where sometimes, when I am working when a caseworker brings in a child in the foster care system, they've said in session that they really do not want this child to receive a diagnosis of autism because they worry that they won't be able to place the child in a home because the foster parents are going to be nervous to take a child that has this label or diagnosis. And I'm not saying this to make you think that, a professional will be swayed one way or the other based on these different factors. But it is the responsibility of the clinician to really understand the perspectives, surrounding this whole diagnostic process and take steps to resolve tension or conflict when it exists, right? it's not so simple. And I think, you know, I think it's just so important that we are open about the process and open about all of the factors going on in the assessment process, because it's critical for really forming a partnership and an alliance with caregivers in diagnosing or in evaluating their child and uncovering the needs of a child. I think we talk a lot about gold standard assessment in autism. And unfortunately, I think a lot of times people have come to think of gold standard assessment as administration of a specific tool. Unfortunately, a lot of insurance companies think that way, right? Like they require us to administer a specific tool in order to feel confident that this child really has a diagnosis of autism. And I am here to say, dispel that myth, that there is no score on any one tool that is going to give someone an autism diagnosis or not. And that's really important for everyone to know. The process is so much more nuanced and complicated than that, and it is so reliant on the people who are close to the individual. And I think the more that that we can work to communicate that to parents, hopefully the more the better our alliance and partnership will be. I put animations in and I always forget to actually advance the animation. So I'm often just talking in front of a blank screen. So just checking. The other side of the coin is understanding kind of parent or caregiver perceptions of the autism diagnostic process. So this is really important, obviously, for us as clinicians, because we know from the research that a positive diagnostic experience is associated with greater levels of acceptance of the diagnosis and lower stress, better coping, or a whole host of really important things. And so it's really important for us in the ANDD clinic to understand some of the key themes that parents are thinking and experiencing as they navigate this process and take steps to address them. One of the key themes is just attitudes and knowledge of professionals. We have a lot of parents who arrive to us already kind of distrusting of healthcare professionals because their concerns have been dismissed for a really long time, and they had to fight really hard to even get their child referred for a diagnostic evaluation. Where concerns are dismissed really early on. And this is especially true for families from marginalized groups, unfortunately. And so here on the right, I have some things we're doing in the ANDD clinic to try to address some of those things. So we're really trying here to engage with community providers who are embedded within these systems that families are already embedded in. So primary care providers, early intervention, birth to 3 providers, really trying to work with them to develop better methods for within practice identification, better awareness of early indicators of autism. And just because it turns out that parents are actually incredibly accurate at identifying first concerns of autism, and we really should be listening to them. Another is wait times, which is just the bane of our existence in this field. There are just far too few people diagnosing autism or evaluating, conducting diagnostic evaluations. And because of that, there is often a very long wait. And while parents are waiting, there's often a lack of communication, a lack of information. They have no idea when this is going to happen. They don't know, they know that something is different about their child, but they don't know how to help them. And they're often awaiting access to services. And what we can do and what we're trying to do to address that is set really clear expectations about the wait list and provide supports to families while they wait. And this might include referring them to other providers in the community for diagnostic services if they might be able to be served faster, or starting service lines within ANDD. We're going to be piloting some service lines where we're able to coach and train parents on how to how to intervene on social communication and play skills with their child, because you don't need a diagnosis to do that, it turns out. So we're going to be doing some of those things. Understanding and acceptance of diagnostic methods. A lot of families come to the diagnostic evaluation completely blind to what is going to happen, what information needs to be collected, what autism even is a lot of times, and they have concerns. What if my child doesn't act the way they normally act during this one appointment, right? What type of information are you going to need? And that is a really great point. And so we're really trying, we have our wonderful family navigators here who are trying to connect with families well in advance of their appointment to prepare them for the type. This just goes back to transparency, really prepare them for the appointment. Based on the age of their child and how their child is presenting, what might their assessment look like? So parents can start to think ahead of time and be better partners in that diagnostic process. And also, developing some enhanced triage systems, because every person coming in should not have the same assessment, not just because of their age, but because of their presentation and their unique needs. Every child does not need a 3 to 4 hour assessment on one day, right? So how can we collect information ahead of time and tailor that process that best meets the needs of the child and families? Also, delivery of diagnosis. It turns out it's really important how the diagnosis is delivered by the diagnosing professional, because it really sets the stage for how families are going to receive the news, how they're going to move forward in terms with engaging appropriate services. And this goes back to somewhat the language that we use, really coming at this process from a strengths-based, neurodiversity affirming perspective when we're providing that feedback. And also dispelling any myths or guilt families may have about the autism diagnosis. Another key thing, a theme that comes up, which is critically important, is that the evaluation process does not stop on the day of the evaluation. We have got to consider post-diagnostic support. And this is where Waisman and Wisconsin are just incredible, in my view, coming from other states. We are so lucky in this state to have so many incredible partners and resources that our family navigators immediately try to engage families with in order to foster community, engage them with different resources based on their unique needs. I've included just a couple here right now, and that the Waisman Autism Resource Line is another amazing one for individuals who are older to contact about services. And of course, the Autism Society of South Central Wisconsin is so important in fostering community. So we're incredibly lucky here for that. But I just think it's really important that as professionals, we really conceptualize the diagnostic process as so much more than one day and one point in time, and offer supports at each phase of that process. I hope I'm doing okay on time. I think I'm still okay. Someone raise a white flag if I'm going too long. I do want to just touch briefly, because with the increasing barriers involved in receiving a diagnosis, different groups of caregivers and individuals are sometimes seeking alternative ways to get support for their needs and get answers to their questions, right? And one of those ways is obtaining an educational classification of autism through their local school systems. This is a wonderful way to get support within the school system. So, and it's a process that involves, somewhat similar to the comprehensive assessment I described before. The child goes in and they're evaluated by a school team. But the key difference is that they are, and really the purpose of that evaluation is to determine if they meet eligibility to receive services and supports within the school setting. But a key difference is that they're not basing that eligibility decision on the diagnostic criteria of autism. They're basing it on whether or not the individual has a disability that warrants, that is going to impact their academic functioning in the school system, right? And so and that they can be found eligible under different categories, one of which is autism. But many times individuals will come to us and say, well, I already have a diagnosis of autism because I got it in the school system. But it's important to realize that that is not an educational classification, is not the same, and they're not interchangeable. So just because one has an educational classification does not mean that they will also be found to meet criteria for a medical diagnosis of autism. So just want to clarify that point. It's a really confusing point, but I think just important to address. Another point is that adults, especially, and older adolescents are increasingly self-identifying as autistic, which is wonderful in so many ways, right? I think there's so much increased awareness of neurodiversity and autism specifically. And it's such a wonderful way for individuals to have self-understanding and find a community that can understand the differences that they experience within their lives. But it's also important to realize that self-identifying as autistic or neurodivergent does not, it's not synonymous with having a medical diagnosis of autism, which can sometimes be essential for accessing supports and services. Unfortunately, even a medical diagnosis of autism does not always mean that they're going to open a door of services. We need so much more in terms of serving adults with autism in our community. But I just wanted to touch on those key differences because it's something that comes up a lot in our clinic, and I think it's just really important to differentiate. In closing, I just want to say that, the process of obtaining a diagnosis is just that. It's a process. It's a journey. It starts well before the day of the evaluation and extends far after it. And our goal here at Waysman is to really connect you to meaningful supports and information and build a partnership with you to support you wherever you are in that long process, and be here as a resource for you. So I'm so happy that I got a chance to be here with you today and get a chance to speak to you about something that's so important to me. I think we have a little bit of time for questions, if there are any. I see Oprah coming down the...
Yes.
Okay.
And we actually had a question in the chat.
Okay.
And so the question in the chat was, is there a difference in assessments for girls than there is for boys?
That is such a great question because the the answer, I think, objectively is no, in that we are still looking at the same. The DSM does not have a set of criteria for boys and a set of criteria for girls, even though we know as professionals, and I'm sure you know as parents and caregivers, the clinical presentation of autism in girls versus boys can look vastly different. But really, it is up to the professional to be able to work out the nuances and ask questions to capture the subtle differences and how those symptoms might present, how delays and differences in social communication and social interaction can look across boys and girls. And I'm happy that's a really long, as a field, we are trying to develop, a lot of people are doing some really exciting work around creating different instruments that will capture those differences more specifically. And I'm happy to talk about that at length offline, because I could go on forever about that, but it's a really great point. Oh, yes.
Hello. Relatively recently, the diagnosis of Asperger's got rolled into the diagnosis of autism.
Mm-hmm.
I wonder if you could comment on the huge range of abilities of people with autism, where I think the public perception of autism is somebody who is basically unable to function at all. And current diagnoses get people who are very, very high functioning, and they all get lumped into one name, which I find to be problematic. But I wonder if you can comment on that subject.
Yeah, it's a really good point. I think that's really our responsibility as a field, to provide a lot of education on how vast the phenotype of autism can look, not only across gender, but across ability. And I think that we are moving there as a field. It's slow, it's not as fast as we would like, but I do think there is so much more increased awareness within the community right now that autism does not look one way, that old outdated view of autism as a disorder that, you know, you're not going to be able to have independence or whatever, you know, myths there are about autism out there. I think that's really being replaced now as our field moves more towards a neurodiversity affirming place. TikTok is helping with that, I hear. I'm not on TikTok myself, but I mean, I really think that it's up to us as a field to provide a ton of education in the community and in our evaluation appointments about that and about the unique abilities and strengths, and how autism can present just very differently.
Are there any other questions?
Yes. For 2 comments. First off, as an autistic adult, I really disagree with that. I think that whatever our needs, we can acknowledge support needs. We can acknowledge people that there are people with 24-hour care needs and do have needs. But honestly, function labels do not help us get our needs at all. It just says how convenient we are to other people. The second question: play skills. I thought play was supposed to be fun.
Yes, I'm happy to address that. Thank you. Play is absolutely supposed to be fun and is critically important. But I think when I talk about developing play skills, a key point that maybe I didn't articulate well enough is that in our intervention efforts now, we're certainly not trying to change an autistic individual. We're trying to help develop skills that are going to be really important for forming social bonds with other people. For children, play can be a wonderful way to connect with other people, right? To connect with your parents and caregivers and to connect with other children. We want to give children the skills and ability to be able to play reciprocally with other people. So I didn't mean to suggest that we were trying to get them to play in a specific way. Sorry if it came across that way.
All right. You had one question? One final question.
Hi. I understand that there's a educational diagnosis and a medical diagnosis. The educational diagnosis gets our little one support in school.
Mm-hmm.
What does the medical diagnosis get her?
Yeah, it's a good question. So a medical diagnosis can be important for accessing certain services, for example, applied behavior analysis. Certain insurance companies will require a medical diagnosis of autism in order to pay for services that are offered outside in the community oftentimes.
Wonderful. Thank you so much, Lily.
Thank
We'd
you
like to
so much.
transition to our next presenter.